Now, all these problems are something that isn't very, often discussed amongst women openly. How would a woman know when there is a cause to be concerned about, or something that they should really come forth and discuss with their doctor?
Yeah, women don't come forth very openly to discuss these things. Sometimes it's teased out at a history, when you're talking to the patient, when you're having a conversation with the patient, and sometimes it's probably the last thing they tell you before they leave the room. It's called the hand at the door syndrome. As they're about to leave the room, they turn around and tell you, by the way, doctor, I've got this problem. What do you think? It's usually that sort of thing.
Yeah.
And most, suffer in silence. Most suffer in silence.
Why do you think this is so? Why are women...
There's a taboo attached to it. People don't talk about sex openly. As I think I've said this before, I think the younger generations now are not too shy about it. The slightly older generations are slightly more conservative.
And I think what's very important is that their partners or their spouses, they play a very big role in this too. What should a spouse or a partner do to help these women who are suffering with, perhaps a decrease in sexual desire?
Yeah, a very difficult question again. So if it's psychological, then, and if it's it's appreciated by both, then some form of marriage counseling or psychotherapy would be advised. If it's psychosocial reason behind it. But if it's medical, then treat the underlying medical problem. Spouses have to play a very supportive role, and it's a two-way thing. It's both ways.